tank. You know what I'm talking about? Huh? And even if you wash those things, they smell clean until you sweat again, and then they just smell awful. Right? At that point, there's really not much you can do with those clothes except throw them away. You cannot get that smell out. It just smells awful. Right? And it's hard. Like sometimes I have a student who does that, and it's really hard for me to tell them that because I don't want to hurt their feelings. Right? And almost no student's going to tell them that either. Because it's just hurtful when you tell somebody that it smells good. Right? It's just not good. So the other day I was, recording. Are you recording me already? Okay. Okay, let's talk about infections that affect the skin. We're going to talk about cellulitis first. Cellulitis means an infection of the skin. The more scientific term for this is pyoderma. Derma meaning skin, pyo meaning pus. So this is pus that's building up within the skin. So here you can see a furnicle. It's a single focal point of infection. This is a carbuncle. It's got multiple. You see the different heads? If you debride one of those, you have to debride them all. You can't just break one of them. You have to break them all. So here's a follicle being infected. This is a single boil. If you want a furnicle, this is a carbuncle. It has multiple sites of infection. The two principal organisms that cause infection of the skin are Staphylococcus aureus and Streptococcus pyogenes by far. The interesting thing about these two organisms is they have the ability to infect every single tissue of the body. They have adapted very, very well to us, and therefore they have the enzyme systems and the toxins that make them very good pathogens on us. They can infect every single tissue in our body. So here you can see is somebody who probably used a dull razor, right? So for males, dull razors are the worst because if you're using them, you abrade the skin, the organisms get in there, and you develop a carbuncle. It not only looks bad, it hurts, right? When I was in practice, when I was in a medical practice, not me in practice, but me as the microbiologist, we had a young lady come in, and I'm going to tell you the story. She looked at us and she said, I have a really big problem with a big pimple. And we're like, uh-oh. So I was thinking Boston cyst right away, but then she turned her head and you could see it was huge. Big old granuloma. So I got everything ready, and I told the physician I was working for that this huge abscess is going to need to be debrided. She goes, okay. So she went and looked at it. She poked her head out of the room and said, I need a number 10 and 2 emesis space. And number 10 is a scalpel. And so I went in, brought him in, and she said, put the emesis space in here, and then she gave a little bit of lidocaine, deadened the tissues around it, just numbed them for a while, and then she just cut. Does everybody know what an emesis basin is? It looks like a little kidney, and it's used a lot of times because it fits perfect here. If you spit up or vomit or whatever, it's to collect those. Well, it can also be used to collect stuff out of a big abscess. So we had it right there, and we probably collected about 300 milliliters of stuff from this abscess. So I got really excited. I went over and I was ready to culture it, and the doc said, I need you to come back. And she came back. And at this point, she straddled the patient. I'm like, what is going on? So she cut again, and a little bit more came out. But then she said, I have to get the core. And so she was pushing on it like this. And she said, you just move over just a little bit. She goes, because it might just explode when I push on it. It didn't explode, but when she was pushing it, it went, and a big old granuloma fell in the emesis basin, plus about another 300 milliliters of serous sanguineous fluid and pus. There's a lot of stuff back there. There was a hole in that lady's neck. I'm like, how did she survive? But the doc sutured them up, put a Penrose drain, a little bit of drains in it, and put a bandage on it so that it could ooze a little bit. And then she came back in another week and was taking antibiotics. It cleared completely. She looked great. Yeah. You could barely see the scar. The doc did a good job. Wow. But you're going to see these things a lot. You're going to see these infections a lot. This is impetigo. Anybody ever seen impetigo? Who's got kiddos, little ones, right? This is very common in little kids, and it's very contagious. The etiology is Streptococcus pyogenes, and so here you can see how it starts off kind of moist and then it develops real crusty. This is very contagious. If you have a person with impetigo in a daycare, everybody's gonna get it. It's amazing. It's easy to treat. It's Streptococcus pyogenes. You can put a topical on there, but a lot of times if it gets this far gone, you're gonna take an oral to get under control very quickly. Okay? So this fifth exam is mostly about etiology and infection, right? It's about, so if I ask what is the etiology of impetigo, you're gonna say that it's Streptococcus pyogenes. Okay? This is folliculitis. This is a part of the case study. So when you get your license, I have 3 of them, you're gonna have to do some work every year to make sure that you keep up with learning. It's called professional development, right? Or continuing education. So this is part of a case study. This young lady was gonna go on a cruise, and she decided to get herself looking real good, so she was gonna she got a wax job, but the wax was contaminated with Staph aureus. So when they put it on there and they pulled it off, there was a bunch of little wounds that happened, and so then the Staph aureus just moved right on in there. So if you think about it, you can put a topical on there, but it's not going to work fast enough. You're going to have to take an oral, right? And so the oral drug of choice here for this, because Staph aureus is resistant to a lot of penicillins, so therefore it's erythromycin that we use. Okay, which brings up my favorite antibiotic presentation of the semester, which is the erythromycin one that you all did in group 4. It was just gorgeous. It's gonna be my example for a long time. It was just gorgeous. Okay. This is necrotizing fasciitis. This is a flesh eating disease. There are several flesh eaters. There's Staph aureus, Streptococcus pyogenes, Vibrio vulnificus, and there's Mycobacterium ulcerae. And there's more. But those are the more common ones. So the most common of all is Streptococcus pyogenes. So here you can see that you had the infection spreading on the foot. A physician came in here and cut out all of the dead tissue. That's why it's called necrotizing fasciitis. This is all dead tissue. There's some dead here, but it's still there. But then they're gonna this is a Penrose drain, so it doesn't allow for the serous sanguineous fluids to pool. They're gonna graft, and a lot of times, where do they get the skin to graft? From your bronchus. So you can get it from a tissue center, but it's better to get it from the person. And you just take a few layers of the skin, it doesn't really hurt that much, and you put it on there, and it'll grow a lot better, and it's not gonna be rejected because it's your own skin. Okay? This young man, this is about the 6th surgery he's had. So they got the infection under control, but it had almost destroyed his entire face. And this was after several surgeries. He was going to have 3 more after this because the physician, the plastic surgeon, I don't know why we call them plastic surgeons, but we call them plastic surgeons. The person who was going to do the reconstructive surgery thought that he could make this individual look fairly normal. But this stuff can move so fast, right? There's images here. This person did not survive, he died. And this person, you can see that they cut out all of the tissue here. In my case, what they should do is pull these together and suture them real tight. The skin is pretty pliable and will allow it to be pulled together and sutured. Because if you leave it open to this, you're just asking for trouble. Right? And so that's it. Fatalities are pretty high, right? And so my next, like 3 houses down, he was doing trimming of the trees, and he nicked himself with the saw, with the chainsaw, and put his gloves on. The worst thing you can do is make a site that's been wounded moist, and that's exactly what you do. You put work gloves on, you make it moist. So he was doing this work in the morning. And then he started hurting. You could see it kind of moving in his arm. And so by 7 o'clock that evening, he was fighting for his life. That's how terrible this stuff was.
Is it traveling blood or is that the skin?
In his case, it did get into the blood, but usually it's superficial. It's just gliding on the actual skin. It produces coagulates and hyaluronidase, the whole bag of horrors, and it's just consuming everything it comes in contact with.
So you need to act really fast.
Strep pyogenes, if it causes strep throat, it's not as bad, but depending on how it gets in your body is how it's going to react. And if it has nothing to stop it, it's just going to move very fast. So my personal experience with this is my dog, Bandy. Bandy, we were playing in the backyard, I threw a ball and she chased it and she tore her ACL. She was really young, and so we thought we'll do surgery so that she could live a really great life, because I didn't want her to be hobbled. Well, the vet tech who did the work put her on a hot plate, and the hot plate was too hot, and it singed her from there. And she developed an infection. This is Streptococcus pyogenes, and so that's what it looks like when I started to shave it to follow it. And then it got really bad, and you can see where I marked it with a Sharpie to where I thought the infection was. This is the vet, and the vet is looking at the skin, and she's telling me we're going to take her back and remove all this skin. And then we'd like to keep her overnight. We're going to put her on intravenous antibiotics. We're going to keep her overnight. What that meant was they didn't think she was going to survive overnight. They thought she was going to die. And, but she survived. And, this is her after 6 months of aquatherapy. So every day, 3 times a day, we would pull her into the shower and we would gently kind of go over the wound so that we remove any of the debris. And then I would kind of clean it around, and I would, anybody know what Solvadine is? Mm-hmm. So Solvadine is usually used for really bad sunburns, but it's got silver in it, and silver's really good, and so I would put it around, and it would stop her from getting other infections like yeast infections and things like that. So for about 6 months we did this, and Bailey got so used to taking a shower, and I would open the shower and she would go right in, right? So she was a really great dog. And she loved people. She didn't like other dogs, but she loved people. And we'd be walking and she'd see somebody like 4 blocks away, and she'd just sit down and wait for them to come up. And I'm like, you gotta go, girl. She just wanted them to come by and say hello to her. And we'd be at the park, and then little kids would come up and pet her, but the parents wouldn't let them pet her because this is the scar she had, and people thought, well, there's something really bad wrong with the dog. There was nothing wrong with the dog. But I get it, and it's really hard to explain to parents that, this is an infection that's already abated, it's not there anymore. But I mean, I get it, right? I get that parents want to protect their kiddos, and so therefore. Bailey lived another 6 years, and then she died of uterine cancer, which had metastasized and got to her lungs. And so we had to put her down. She didn't want to go. She wanted to be with us. She was in pain. Any questions about necrotizing fasciitis? This is erysipelas. Erysipelas is usually we see it in older individuals, and their cheeks look really red. Sometimes it's only on one side of the face. The skin is very malleable. You can push it down on it. It's pliable. You can, you push it and come right back up. When people have erysipelas and you push down on it, it's like there's a little 3x5 cardboard underneath it, and therefore it makes it really hard, and the skin becomes less pliable. A lot of times you can see this in elderly individuals. Elderly individuals don't even know they have it, right? I've been at certain places, and I kind of said, ma'am, I know you don't know me, but I don't want you to be hurt. I think you need to get your face checked for an infection. And sometimes they took it, okay, he really wants to help. Sometimes they took it like, run your business and stay away from it. I try not to get involved, but sometimes I just can't help it. I just see things, and it's sad sometimes. Right? One time there was a gentleman sitting down, and a lady who walked up and was having trouble walking. I mean, you could tell, and the guy wouldn't get up. I went over to him and said, could you let the lady sit down, because she's in trouble? And he looked at me and said, I was here first. There's nothing you can do at that point except just. I went and asked the pharmacy if I could pull another chair out for the lady, because it's just sad how people don't care for each other. If we look at this, you can see this is cellulitis, which is more diffused. This is erysipelas. Remember I told you it's like a cardboard, so it's kind of localized to the superficial parts of the skin. And this is an abscess, right? And so here, this particular organism, these abscesses are formed, a lot of times they produce coagulates, and coagulates forms this fiber network around the infection. It's a core infection. Okay? Any questions? We move to anthrax. So anthrax presents itself in three different clinical presentations. They're all pretty rare, but people ask about it all the time, so I just put it in. Right, so the three clinical manifestations, the presentations are cutaneous on the skin, which is the more common one, pulmonary, which is the one that the bioweapon has been made for, and then GI, which is just, I thought, an anomaly. Let's talk about the GI because I don't really have a slide for it. So in the late 1990s, there was a huge famine in Africa, and there was no food for people, so they started eating carrion. What does that mean, Harlow? They started eating carrion. They started eating roadkill. Can you imagine being so hungry that you would be willing to eat roadkill? So the spores got into the intestinal tract, they attached themselves to the small intestines, and they started to grow, and we started to see lesions on it. And this was written up in a clinical paper that was presented at a conference I went to, but it's very rare. We don't see it very often. Okay. This is the cutaneous form. It's on the skin. It's more common. And Bacillus anthracis is a lot of places. Any place where there's domestic animals, and I'm not talking about cats and dogs, I'm talking about sheep and cattle and horses. You're going to have this organism. It's zoonotic. It's with them all the time, right? And so that's why I have a picture of all these animals, right? But here you can see there's an eschar. An eschar just means there's a scab, if you will. And then you have an area of edema, swelling, and an area of erythema, which is reddening, right? And so this is kind of classical cutaneous anthrax. It can be treated mostly with penicillin. It's very low drug resistant. But there is a weaponized form of it. And so there's a book called Biohazard, if you want to get the book. It's a scientific read. The masses aren't going to be interested. It was written by Ken Alabak, who used to be one of the people in charge of the weapons program for the former Soviet Union. By the way, the former Soviet Union, they had about 60,000 people and about 30 facilities working on this type of research. Do you know how many we had working on countermeasures and vaccines against these infectious agents? 3. Who do you think made more progress? Oh, and by the way, when the Ukraine was invaded, Pripyat is a little town there, and that's where a lot of these things were kept. Nobody knows where they are anymore. Interesting. Crazy. But they had the weapons, they had genetically engineered Bacillus anthracis to be resistant to all antibiotics except the fluoroquinolones. And so that's pretty interesting to think about how that went. When 9/11 happened, there were instances of people sending mail with the endospores to Bacillus anthracis mixed in with talc. And so they would open up their letters and the talc would fly in the air and you would breathe it in and then you'd get sick. I think 5 people died and more people got sick or something like that. But that was during that time, right? And the people who mostly were affected by it were the postal service individuals who were sorting the mail. And the mail gets scanned, it puts so much pressure on the letter that poof, it popped and all the talc went all over it. And so people got hurt because of that. Okay? The interesting thing about pulmonary anthrax, we used to call it wool sorter's disease because the only individuals who ever got pulmonary anthrax were people who shear sheep. And when they shear sheep, it's dusty and it's up in the air and you breathe it in. But also now there's a weapon. And so if anthrax lands in your lungs and it hits your lungs, whether or not it causes anthrax there's going to be a lot of factors involved, like your immunity, diet, all kinds of different things. If it's the weaponized form, it's got silica on it, and now it pierces the lungs immediately. So it's 100% chance you're going to get an infection. This is the number one organism on the bioweapons list because of how easy it is to grow, right? And it can be disseminated, this endospores of this organism can be disseminated very easily in HVAC systems, or like, for instance, if you're at ACL, you could do a big balloon with the spores inside of it and put a firecracker in it and have the firecracker go off. Poof, it pops. But then it lands here, but the prevailing winds take it north, and that's just where all people are, and then we get a whole bunch of people exposed. Those are the things that used to worry me a lot. But I figured out is you just can't worry about these things. Then you just never will sleep. What's that? Bree?
So we're all gonna die.
At some point, yeah, but I don't really want to die of pulmonary anthrax. Right. Good. So this is leprosy. How many people think leprosy is a problem in the world still? It is. So we have people who have leprosy in Texas. I know 2 of them. But they're never going to tell you that they have leprosy because it has such a negative connotation associated with it. If somebody were to tell you, if I were to say I have leprosy, then you guys probably don't want to be near me, right? And so it's the same thing with HIV. Do you remember when kids had HIV and then nobody would be their friend? Mm-hmm. And they had that little poster. Michael Jackson kind of instigated the whole thing because Ryan White had HIV and nobody would be his friend, so Michael Jackson got on an airplane with Liz Taylor, got on an airplane, they went to his house, and in front of everybody, with the cameras running, he gave him a big old hug. Right? And then that little poster came to be where I have HIV, please hug me. That came to be because you can't get HIV from a hug. And so it's pretty interesting to think about. Leprosy is the same way. It is communicable. You can give it from one person to another. But usually it has to be an active case and you have to have an open lesion in order to pick it up, right? And the armadillo in Texas is a natural reservoir for leprosy. I'm gonna tell you, when I was a little kid, the dillos were our playmates. We would pick them up and run with them. We'd play football with them. They would be the football, they'd be screaming the whole time. We didn't really know we were causing damage to the dillos, but they would scratch us all up, and we never got that. At least we don't know. I don't have it right now. Mm-hmm. It takes such a long time for it to develop, right? So it usually will infect areas of the body that are cooler than body temperature, right? So the toes, the nose, the ears, the elbows, places like that, right? And it's so interesting. It can cause severe peripheral nerve damage, so you lose the sensation of light touch in those areas. As a matter of fact, when people are testing for it, they still do the feather test, where you can put a blindfold over you and they'll just kind of go over and see if you feel things, right? Because if you can't feel when they're touching you with a feather, that means that there's been so much damage to the posterior corpuscles you no longer have that light sensation. Leprosy itself is very slow to grow. It takes about 12 to 14 days for one cell to become 2 cells, right? And so here you can see that this is complete denuding of the fingers by leprosy, right? The fingers have been just digested. Here you can see there was so much damage, there was an amputation. This is cell-mediated damage. So leprosy doesn't do the damage, it's a cell-mediated immune response that does the damage. Right? It's the stuff that causes inflammation in the tissue damage. Trying to protect you, but it's causing damage to your tissues. Okay? Good. So we do have a couple of things we do nowadays. I used to say that leprosy wasn't curable. I still don't know if it's curable, but it's treatable. And we can give people anti-tuberculosis drugs. In certain places, the BCG can be given, right? The BCG is right there. It's the vaccine for tuberculosis. And the BCG stands for the bacillus. The BCG stands for the bacillus of Calmette and Guerin, which were the two individuals who came up with the idea for the vaccine against tuberculosis. What we know about the BCG is it not only works against tuberculosis, but it's also protective against leprosy. So in places in the world where leprosy is endemic, you see how I'm using the term from epidemiology, if you listen to that. If leprosy is endemic, we give the BCG. We do not give the BCG in the United States, although our friends to the south in Mexico do. Right. But does anybody know why we don't give the BCG in the United States? It messes up our screening tools for tuberculosis. Right? So we don't give them here because if you get the BCG, if you get the vaccine for tuberculosis and leprosy, you will test positive for the TB skin test all the time. And it messes up our screening. Okay? For leprosy, there were several countries in the 40s and 50s where if somebody had leprosy, we would segregate them in an area, right? United States had one of those areas. It's an island off of, on the Hawaiian Islands, and I can't remember which one. Somebody look it up and tell me what the island's name. And South Korea has an area, right? On the eastern side of the island, there's a peninsula, and off of there, there's an area where the South Koreans used to send people with leprosy. Do you know what that area is called? No. It is now a very hotbed for commerce and arts, and even though it's the history is that's where we sent leprosy from. Did you find the history?
Molokai.
Molokai. So, unfortunately, we didn't want people to get exposed to leprosy, and so we just send people to these places, sequestered in there or whatever. That's not the way we would do things today because we know a lot more about the infection center. But that's the way we did things back then. By the way, with tuberculosis, we used to tell people, because we know that the one kryptonite that TB has is the sunlight. So we used to tell people, we're going to send you to this place where there's a lot of sun, and you're going to spend your time in the sun, and you hopefully will get better. That was not true. We were sending them to these sanitariums, right, where they could die, because we wanted people with tuberculosis out of the general population. We have not been good stewards to our citizens, right, over the years when it comes to infectious diseases. And so it's important to understand that. Okay? Any questions about leprosy? There are two different species of leprosy. The primary one is Mycobacterium leprae, and that's the one that's found worldwide. There's another one that's found in the Caribbean, it's Lepratus, and I'll talk about it later when we talk about the nervous system infections. Okay? Measles. So this is a family member of mine. This is one of my nephews, and his mother was an anti-vaxxer. And I said, you need to vaccinate against MMR, and she didn't. And so the little boy came down with measles. I asked her if I could use the picture. She said yes. She now buys into the vaccine idea. But I covered most of his face, and he just couldn't tell. But it can affect anybody, and a lot of people don't understand this, but measles is transmitted through the air. So if you are in a house that has measles and somebody is coughing and sneezing, measles virus is in the air and it can go everywhere in the house. Everybody's in the house is going to be exposed to it. Okay, that's a really good question on the exam. How is measles transmitted? And you're going to say through airborne droplets. Okay. So outbreaks are occurring right now, and so you can see measles gets transmitted through the air, right? But the outbreaks we have are in Texas, and I think last year, this is done early part of last year, so around the summer. So there was 597. I think at the end of the year, we had almost about 900 cases of measles, mostly in this part of Texas, because in that part of Texas, we have a lot of people who are unvaccinated, and not because it's a political thing for them, but because of their religious beliefs. In that part of Texas, we have a lot of Mennonites, and the Mennonites don't believe in vaccinations. We are still having the problem. I think we checked this morning, there's about 180 cases or so of measles in Texas right now. And it's spreading to different places now. It's not just in that area of Texas. The other outbreak that's happened is in New York and in one of the Carolinas, I can't remember which one. But we're seeing measles in these places also. And in New York, it's the Orthodox Jews. And in the Carolinas, I believe it's another group of Mennonites. Any questions? This is toxic shock syndrome. Why is this here? What is that? It's a tampon. Why is a tampon on a slide for toxic shock syndrome?
Because they put chemicals in them.
No, not chemicals in them. Anybody know? So toxic shock syndrome has been around a long time, but it first came to light where people started talking about it when 3 young ladies in the upper Midwest used tampons incorrectly. They left them in for several days. Yeah. And Streptococcus pyogenes or Staph aureus started growing and it caused toxic shock syndrome. If you next time you buy a package of tampons, read the label and it'll say Surgeon General's warning, the improper use of tampons can lead to severe medical complications, including toxic shock syndrome. Right. Now, you can get toxic shock lots of different ways, right? When I was working in the clinical world, we had a 14-year-old young lady come in. The mom brought her in, and the mom and the dad were about to get divorced, and the dad took the young 14-year-old on a camping trip, and they got into a lake, and she got stuck by a twig in the lake, and then she did a toxic shock. Now, I didn't know what it was when I first started to take a history, but what I did know was that the young lady was orthostatic. What does that mean? She was orthostatic. What does that mean? Yeah. So you take the blood pressure when they're sitting, when they're laying, and then when they stand. And a lot of times you can see that there's a fluctuation in the actual blood pressure when they stand, and they either faint or they fall. Right? So that a lot of times that means the kidneys are involved. Right? So she was almost non-responsive. Like and the mom would say she's just not feeling well, or something really. I went to the doc and I said, this young lady's in trouble. I don't know what's going on. The doc went in and she pulled herself out and looked at me and said, "Call an ambulance now." The doctor that I worked for and the mother were talking, and mother said, the last time she was sick, you gave her amoxicillin and she got better. Please give her amoxicillin and let her home. And the doc said, no. And she said, I believe that your daughter is in the early stages of having toxic shock syndrome and she needs to go to the emergency room and be admitted to the hospital or she may lose her life. And the mother would not, like, no, just give her amoxicillin. And then so the doc wouldn't let the girl out. So the mother was insistent that they leave, and the physician I worked for said, I tell you what, if you will get your family physician on the phone, and if he gives me the authority to release the child into your care under his name, I will do so. So that's what happened, but the family physician talked to the mother, and about that time the ambulance came, and you could hear her physician just yelling at her. You're crazy. But anyway, the young girl went to the emergency room. Within an hour's time, she was in a coma. She was out. She was done. But she stayed in a coma for about a week, maybe a little longer, and then she came and got over it. When you're in a hospital, they give you dialysis and a bunch of other things when they need to get you back to where you need to be. So about a month after that, maybe a month after that, the girl came over to the dad brought her, the girl came over to the clinic and brought a cake that she had made for the doc to thank her. And then she let the cat out of the bag. The reason the mother didn't want to tell the young lady to go to the emergency room, she said, oh, my mom didn't mean anything bad. She was having a party and she didn't want to, she had to get ready for a party. So there's some things more important than a party, like your kiddos, right? So it's just amazing. Okay? This is scarlet fever. So scarlet fever used to be a big problem. It's no longer as big a problem. It was because of penicillin. So we started giving penicillin for Streptococcus pyogenes, and even today, it knocks it out like that. Streptococcus pyogenes has no resistance to antibiotics. Penicillin will knock it out. And so that's really cool. I prefer the shot, but a lot of people don't want to take the shot. If you take one shot, you don't have to do anything else. If you're taking penicillin, a lot of times you're going to take a BID, TID, or QD or QID for 2 weeks, and so why do you want to do that, right? It's just give me one shot and I'll be taken care of, right? It's amazing how quickly that will work. But this is a diffuse rash, and this is strawberry tongue. You need to know that for the exam 5. Those are classic symptoms of having scarlet fever. Scarlet fever, this is kind of a diffuse rash, and here you can see the entire skin on the foot has exfoliated. This is ready to be cut here. Do not pull that off. It's like a big blister, and if you pull it off, you're going to have a lot of raw skin underneath it. So what you do is you cut it a little bit at a time as it's ready to be removed, because the skin is no longer there, and the skin underneath is fully formed. Right? And so it's like pulling the skin off of a blister. Man, that hurts, and then it hurts for a long time, right? It's better just to leave the skin to protect the blister until it's healed underneath, and then the skin will fall off by itself. You just have to remember that. Anybody have any questions? Okay. All right, now we move to the eyes. This is pink eye. This is conjunctivitis. And the two principal etiologies are Staph aureus and Chlamydia trachomatis. So I have gotten pink eye before because when I have really bad allergies during cedar season, I'll blow my nose. But I don't do a really good job of holding the tissue, so when I blow, things get blown up into my eyes, and then that's a problem. Right? I can remember being a camp counselor when I was like 18 or 19 for my Episcopal retreat, and then we practiced in the Eucharist, and the priest would bring over a little goblet of the grape juice, right? And little Johnny touched it to his eyes, and he had pink eye. And then when it came to me, and the priest went like this, I'm like, and so later on he told me, why did you not participate in the blood of Christ? I'm like, because little Johnny has pink eye, and I don't want to get pink eye. We had 5 campers get pink eye from him, sorry. And after that, we went to the little bitty single-use plastic thing, so you drink a little grape juice and nobody gets sick. Chlamydia trachomatis is the etiology of the sexually transmitted infection known as chlamydia, but here it can also cause infection of the eye.
thought you only got pink eye when somebody farted.
What now?
No,
People what?
I say that all the time. Who farted on your pillow?
That is completely wrong. As a matter of fact, that would just really be mean if somebody did that to you. But you're not gonna get pink eye that way at all.
I swore that's how I thought you got it.
Then how do you
How do you get it?
Ooh.
That's how you get it. Because Staph aureus is found in your nose. Okay? So if you do this, and then you go, well, that's another way you're gonna get it. Or, you like the guy so much, you decide to kiss him even though he's snoozy, and you're like, "Ooh, but I'll kiss him anyway because he's cute." Okay. I know y'all have done that before. And that's another way you can get pink eye. It's mostly through personal contact. Or goblets or glasses or whatever. Fomites. This is a fomite. What's a fomite? Inanimate object. Y'all better watch that epidemiology video. Annalisa, for some reason, I knew people were gonna watch. Have you watched it, Annalisa? Oh my God! You do know you have an exam on Thursday, right? Oh, you were studying for your exam. That means that other class is more important than this one. I don't think so. All right. So this is my student from about 3 semesters ago, and she gave me permission to use her image. I wanted to like cover the eyes, but then you can't really see what's happening. Can you see all the pus coming out of her eye? It is amazing. So what happened, she was a nanny for some kids, and they had a dog, and they had a little toy, and inside it was filled with water. So it gave it some balance, it would bounce all over the place. So she bounced it, and it was old, and it popped, and stuff went in her eye. And she got an infection. That's Pseudomonas aeruginosa right there. That is bad. And so the doc said we have to get this under control really quickly, because if not, Pseudomonas aeruginosa can completely digest your eye. Well, she's perfectly fine, but she gave me the picture so that I could share it with you. She is now about to graduate from nursing school. I have a whole bunch of them graduating this May. They've invited me to, they hold pinning ceremonies when you can't go. At 9 o'clock in the morning, who can go? I'm teaching a class. I can't go. But I'm going to graduation, and I'll see them there. So it's pretty interesting. This is gonorrhea of eyes. It has completely digested the eye. The eye is no longer there. So this is part of a good prenatal screen. If you're going to have an infant, they want to check you for the big four. The big four are gonorrhea, syphilis, herpes, and then another little organism you might have heard of, Streptococcus agalacti, which is group B strep. Because if you've got any of those, we want to treat you before the baby comes out of the birth canal, because if they come out of the birth canal, they can pick up the organism that can cause a lot of damage. Okay, good. And then here is a viral infection, right? And then this is herpes. And so herpes is really serious. It can cause complete occlusion of the eye, which then can lead to blindness. Okay. And then lastly is the amoeba. So the amoeba typically, remember, what are Provy's rules of water?
You don't like still water?
If it's still, don't get in it. Not a swimming pool, but a lake or a river. Number 2, not yet. After a rain, you wait 2 or 3 days, let everything clear out, then you can get into the lake or river, right? Now what kind of hot? 80 degrees Fahrenheit or warmer, you stay out of it because the amoeba like warm water, okay? Not salt water, they can't handle salt water, they die. it will mess with their diffusion.
What if you
But
just
fresh
cut
water.
off?
What does this mean? What does this mean? What did you say?
What if you just cut off?
Just put some, no, don't work that. Don't work that. That's why I don't like neti pots at all. No. No. You're asking for trouble with a neti pot.
I
Right?
love a good nitty pot.
Do you use sterile water?
Whatever's in my faucet.
That's why I don't like neti pots, okay? So, yeah. Okay? Anybody have questions about the skin? Alright. Time for respiratory.
I know.
What's that?